Now to the major development in the fight against COVID. In an unusual decision, CDC Director Rochelle Walensky overruled agency advisors to expand the number of people who are eligible for Pfizer's booster shots. At-risk workers are now included under new guidelines in addition to those over 65 and people with underlying medical conditions. Dr. Nick Highsmith is here with us to discuss what this all means. He is the Medical Director of Infection Prevention at Le Bonheur Children's Hospital. He's also an associate professor at the University of Tennessee Health Science Center. So, Doctor, what do you make of Dr. Walensky's decision to recommend that Pfizer booster for frontline workers and those at high-risk exposure to COVID? And I guess, more importantly, how unusual is it for the CDC director to overrule the CDC advisory panel?
Yeah, good morning. Thanks for having me. It was a very interesting turn of events. So yesterday, we had seen the FDA's recommendation for individuals greater than 60, high-risk conditions, and as well as healthcare workers. And then, early on in the day yesterday, it looked like the CDC was going to go ahead with that, with the caveat not to include the frontline healthcare workers. So, from an infectious diseases standpoint and from the data that we've seen out there already, that's sort of what me and my colleagues were sort of expecting. That seemed like where the data was leaning and what most fit. And then yesterday, late yesterday evening, we're seeing that the director of the CDC has overruled that and will now be including the frontline healthcare workers. So I fully support the CDC and their decisions, and they've done a great job of leading us through this pandemic over the last, 18 months, a little over 18 months now. I think that, we've seen a lot of studies looking at immunity over the last several months, and what exactly does immunity look like? Does that wane over time? What role do the individual, memory cells and things of that nature play into long-lasting immunity? So I think that while this was a slightly unusual decision that was made late yesterday evening, we are in support of that, and I think that those on the front lines support the CDC and will get the vaccination.
So can high-risk individuals, this is the big question that people ask all the time, and I'm sure you get this question too, and we probably ask it of every doctor who appears on our air, but you never know who might need the message. So can high-risk individuals mix and match vaccine boosters?
So for the most part, we think that they can mix boosters. So you can have, as long as they're the same type of vaccination. So the mRNA vaccine, which is the Pfizer and the Moderna product, we feel pretty comfortable that mixing those two products is fine and that you will get the same sort of immune response from those. I think there's a little bit of question mark around mixing boosters, say, for example, from the J&J vaccine with the other Pfizer and the Moderna vaccine. So I would say that if you are eligible for a booster, that looking at either the same type of vaccine you've received in the past, so the Moderna or the Pfizer, is what I'm advising my patients to do.
Okay, let's talk about the debate over the vaccine boosters in general. What do we know about how long vaccine-based immunity lasts? And what do the latest studies show about how vaccine-induced immunity is holding up when it comes to the Delta variant and perhaps other variants down the line?
Yeah, this is a really great and fascinating question that we've actually looked at, for many years with other viruses and trying to compare how other viruses compare to COVID-19. We know a lot about immunity, obviously, from tons of studies that have been done, in the past, that you have your antibodies that are made relatively quickly after vaccination, and then you have your long-lasting immunity, which is composed of T cells and B cells, which sort of stay around in your lymph nodes essentially forever and are there to react to viruses and other things that you might encounter in your day-to-day life and then produce antibody. So I think it's a struggle because we look at the thing that's easy to measure in a doctor's office, so antibody levels, and we try to compare or try to make correlations from the amount of antibody that you have to how that relates to your protection against the virus. And there are a lot of new studies that are coming out looking at how long those antibodies are there, and also looking at how well does your body make these long-lasting T and B cells. And we've seen some really good evidence lately that the T and the B cell part, the part that stays around for a really long time, is there and that it is functional. I think the thing that we are most lacking data in is how do these T and B cells react when they see COVID-19 again? Do they produce a good antibody response? How long does that antibody response last? And how well are you protected from that antibody response against variants such as the Delta variant? So what I would say is that I think boosters will boost the antibodies, and I think they're also going to boost our T and our B cell immunity, our long-lasting immunity, and that's going to get us even more protection, especially in those high-risk groups, those over 65 and those with immune-compromising conditions.
Let's talk about this now. The World Health Organization has recommended the use of regeneron. That's the COVID-19 antibody cocktail, which first gained some attention, I guess, when it was used to treat former President Trump when he was infected with COVID. How does the treatment work? What are the benefits? Who's eligible to receive it? I mean, and what are the costs associated? I mean, will insurance pay for this, or is this an out-of-pocket expense?
Right. So we've been accustomed to regeneron here, in the United States for quite some time now. And I'll say that here in Tennessee, where we unfortunately right now have a really high rate of COVID-19 and in our unvaccinated population, we're using quite a bit of regeneron. In fact, we have a bit of a shortage right now where we're having to really look at the individuals that we're giving the monoclonal antibody to. So I think that the WHO backing this is great. I think getting this to individuals who are at very high risk for severe illness, I think that's the key. So those individuals who haven't had natural infection, or those individuals who haven't been vaccinated, that don't have any protection against now the Delta variant and the possibility of severe illness that would lead to intubation, ICU stay, and ultimately death, is a good thing to have this as a piece of our arsenal. So I think the ability to open that up and see that used in some other places is going to be very beneficial in our fight. I think the issue is, like you mentioned, the cost. It's pretty substantial, and there have been calls on the companies to, work with other, tech companies to lower the price of this and increase the marketability of this product, and then really get it out there where it's desperately needed.
After seeing a decline in COVID infections last week, as you just said, Tennessee now ranks second in the nation for positive cases for every 100,000 people. That's according to a state profile report from the White House COVID-19 team. I'm not a doctor, but I'm guessing that part of the challenge has been that people refuse to wear masks and people refuse to get vaccinated.
Yes, that's true. It's been very discouraging across our state, seeing these numbers over the last month and a half. So in the Mid-South, where Memphis is and we are right now, we started school back about a month and 2 weeks ago, which was right at the time when we were seeing the Delta wave move through the Mid-South. And unfortunately, we saw a huge surge in our cases due to just what you said, lack of vaccination coverage in our area, as well as unclear masking mandates for our school system and across our state, where there is lack of trust of the benefits and efficacy of wearing masks. So over the last month, we've really tried to encourage the people of Tennessee to get vaccinated, to please wear masks in public while we are in the middle of this very contagious Delta wave. And unfortunately, we haven't seen that go the way we would like. Here in the Mid-South, we've been able to enact mask mandates in Shelby County, where Memphis is, and get their numbers down. And we're actually seeing a plateau here and a decrease in our pediatric cases. But unfortunately, that's not what we're seeing across the rest of the state. So it's very concerning. And I think the only way that we're going to end this and to get these numbers down is for everyone to embrace masking and to go out and get vaccinated.
Doctor, before we let you go, I mean, it's a question that I've become intrigued by, and I've asked a lot of other doctors and medical professionals over the course of the last couple of weeks especially. How are you doing just as a doctor who, it's one thing when you tell a patient, hey, eat foods, lower in saturated fats, or, exercise, or, you prescribe some medication to help them feel better, and then they follow doctor's orders. But here you've got doctors across the country and around the world prescribing what to do for people, and people are just not doing it, and they're ending up in the ICU. What kind of a mental toll does that take on you and your colleagues there in the medical field?
No, I appreciate you asking that question. It takes a huge mental toll. I think that, at this point in the pandemic, we're at a preventable stage. So it's like preventative care. Individuals go out, at a certain age and get screening tests for, cardiac disease and colon cancer and those sorts of things to prevent illness. At this point, and it's the same thing with vaccinations. We've been given vaccinations in this country for a very long time. Children have to have certain vaccinations to go to public school. And at this point in this pandemic, we're at a place where it's preventable moving forward. We know that these vaccines work. We know that they will prevent the infection. And until we get everyone vaccinated, we know that masks work. So as a healthcare worker, it is very discouraging. It's very disheartening to see the lack of trust in healthcare that has developed, that is affecting all these people and also affecting our children, which is a huge part of what I do on a day-to-day basis. So it's discouraging, and I'm just hoping that once we get over this Delta wave, there'll be a change in perception, and that we can really tighten up on these recommendations, and that everyone will embrace that.
Dr. Nick Highsmith, I salute you and your colleagues. Thank you very much for all that you do, and thanks for coming on.
All right. Thanks for having me.